Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, and we're here today in this Health Supplier segment with Dr. Jason Williams, and we're here to talk about Precision StemCell, Dr. Williams' company located in Bogota, Colombia, and his research into stem cells has actually transcended the discussion that was quite prominent several years back, all the controversy about stem cells. Dr. Williams talks about stem cells that can be obtained from fat and bone marrow. How are you doing today, Dr. Williams?
I'm doing great, Neal. How are you doing?
Great, doing well. You're the CEO of a company called Precision StemCell. It's an outpatient imaging and image-guided treatment facility located in Colombia. Could you talk a bit about how and why you started Precision StemCell and why you're operating in Bogota?
Sure. And we kind of, now we're expanded out. We do some work in Mexico as well, and we've kind of focused a little bit more on research. But to give you an idea of kind of how we first got into it, I'd always been interested in stem cell research, and I thought that it was the future. But for me, I do a lot of spine procedures, people with neck pain, back pain, and I do injections. I see a lot of patients who've had surgery, and then I had the unfortunate problem of getting a couple herniated discs in my neck myself. And I really looked at it and I thought, gosh, I see all these patients who've had surgery. Certainly a lot of times it doesn't work as well as we hope. And, you see the metal in them and those things. And I thought if we could go and use stem cells to regenerate some of the disc and repair these problems, that would be much better. And then when I had my own trouble, it kind of pushed me to look at it, because I decided I didn't want to have surgery, and I wanted to look at the options of maybe considering stem cells. And so I got heavily involved in looking at that, and then we learned of some methods where people were taking fat, and you could isolate stem cells from fat, and you could inject it into joints and use it to help regenerate certain areas. And that's the work that we kind of got into. And we started doing a few athletes and we treated some NFL players and other people, and we had some really good results with it. At the time we were in the United States, and we didn't really know, the FDA didn't really have good guidelines on whether they thought this was okay or not. And now even still in the United States, there's plenty of clinics that are even currently using this technique to treat joints and arthritic conditions. But, it kind of really advanced when, some of the athletes we were treating, they knew of a football coach who had, Lou Gehrig's disease, ALS. And, they said, the stem cells are working great for athletic injuries and joints. Would you consider treating him with it? And so we looked at it and thought about it for a while and decided that we would give it a shot and see, how it did for him. And we treated him, and he did very well. And actually the newspaper did a big story on it, and we kind of became known, which was good and bad.
Now, was he treated with his own stem cells?
Yes, he was.
And is that the standard, or is that how it has to be?
That in the United States, at the time, the FDA seemed a little bit okay if you were using the patient's own stem cells. They didn't really like the idea of some of these donor cells. Now things are kind of changing, and there are some stem cell companies that sell products in the U.S. that obtain stem cells from placentas. And the FDA looks at that very much like donor tissue, like blood, like donor grafts for like ACL replacements and those things. And so that's kind of become accepted. And certainly when you're using donor tissue, it's easier because you don't have to harvest from the patient. And we do, now in the United States, when we do stem cell procedures, we usually use it from the donors, and we usually use it from the companies, because we know that they've already dealt with the FDA, so we don't have to worry about it. We're just using their product like a drug. But But on the other side, we were doing a lot of work with the patient's own stem cells, and when we started seeing the results in the patients with ALS, really curious as to why these patients were improving, because they were getting better quickly, and we knew that it wasn't because they were regrowing nerves. So we thought that something else was going on, and so the more and more we look into it now, now we obviously know a lot more, is the stem cells are producing growth factors that help repair various things. You can do autoimmune conditions, and inhibit some of the problems that you see with that. Patients with stroke, the growth factors can help some of the nerves heal, and those were, that's kind of where we started focusing. We kind of got away from doing a lot of the patient care and started focusing much more on research. And so we don't treat many patients now. We're still kind of much more in the research phase.
Now, how does Precision StemCell get the word out to other physicians who may be extremely interested in these new developments? That's my first question. And the second question is, how does your company get around the negative press that fat gets in and of itself?
Mm-hmm. Sure, yeah, and obviously, the first thing with stem cells is that patients a lot of times still have the idea of embryonic stem cells. So when some of these stories started hitting the newspapers where we're treating athletes and things like that, people would send us kind of upset mails of that, how could you do this type of work that's harming embryos and babies, that they didn't understand that obviously that's not what we do. And as far as using fat, it's definitely been shown that there's a fair number of stem cells that can be obtained from fat. And I think it's more and more, if you educate the patients on it, educate the other physicians, and they see the work, they see that that's definitely a real possibility, and I think it's much more accepted now. And obviously fat's something that's usually easy to get, and people are glad that you take it.
Yeah, absolutely. Now, I also understand that your company deals in stem cells that are obtained from bone marrow as well. Is that better, worse, or are the results about the same?
It's and it's different for different situations. I mean, some of the work, like if you're trying to treat a person that has arthritis and you want to help regenerate cartilage, it's a little bit controversial. I mean, we've seen good results with both. One of the things with fat is that the number of stem cells that you can get is so much more than with bone marrow, and so that's why we kind of leaned more towards fat for that type of purpose, for doing orthopedic conditions, because we thought that we were actually getting much more cells to get a better effect than bone marrow. Bone marrow, though, in the United States is much more accepted because you don't have to do any processing really of it. I mean, you take it and you can spin it down, but you don't have to do the processing like you have to do with fat. With fat, you have to dissolve the fat, and you've got to separate out the cells from it, and the FDA doesn't like that. Even though I know that there's clinics in the United States that are doing it now, but the FDA they have kind of a rule that if you're going to take this, that you have to be minimally manipulating the tissue, and they think that's a little bit too much. And so and that was one of the things that, for me, and one of the reasons that we located some of our clinics in Colombia, and now we do a little bit more work in Mexico, is that those countries were more accepting of this type of work. We also had more options. There were, stem cell laboratories and banking done there. And the FDA, they talked to me in a very nice way. I mean, they were, they weren't rude about it. They just said, hey, we don't really like what you're doing, so we would just like you to not do it.
Well, in a nice way, yeah, in a nice way.
And so I not wanting to create any more trouble. That's when we started looking at some of the work outside the country, and also at that time we kind of started focusing much more on research with that, and we were looking at we wanted to look at some of the substances that the stem cells produce and wanted to see, could we duplicate that so that maybe you don't even have to use stem cells. Maybe we could duplicate it by either giving the substances directly or using a gene therapy. And that's where a lot of the work, particularly in ALS, went, where we were looking more at gene therapy. We thought stem cells were kind of the Band-Aid, but gene therapy probably holds the promise for a true cure.
Now, as we wrap up, what is the ultimate goal of Precision StemCell as a company, as an organization, and how significant is the involvement of like-minded researchers in the United States who maybe travel back and forth in order to glean information and new processes from your company?
Sure. Yeah. So, obviously, since we kind of focused a lot more on research, and we do work with several researchers in the United States, the promising things with stem cells, of course, are the fact that they produce these healing growth factors. And there's been other researchers, in the U.S. and outside the United States as well, that show that administering stem cells can actually be very good for anti-aging. They extend the life expectancy of animals, and it's these healing properties that we really want to try to understand more and try to make it more effective. And we hope that what it'll do, that it'll lead to stem cell therapy that is, more controlled. I mean, right now you've got a lot of different clinics offering stem cells, and some may have something that's good and some do not. And so, I think that it needs more oversight to make sure that patients are getting something that's good quality. But the other thing is that you can't look at stem cells as just kind of a cure-all. I mean, a lot of patients, we get contacted with all sorts of conditions, and a lot of them we don't have any evidence that stem cells are going to help. But the patients, they truly believe that stem cells are the answer for them, and we need a lot more research to show these things.
Now, where can we get more information about your company, Precision StemCell, and get in contact with you?
Sure. So we have a website, precisionstemcell.com, and patients can look on there and get information about some of the treatments that we offer, and it has contact information on there as well.
You've been listening to Health Professional Radio, our Health Supplier segment. We've been talking with Dr. Jason Williams, President and CEO of Precision StemCell. It's an outpatient imaging and image-guided treatment facility located in Bogota, Colombia, and it has the ability to harvest stem cells from both fat and bone marrow. It's been great having you here with us today, Dr. Williams.
Thank you, Neal. I appreciate it.
Thank you so much. Transcripts and audio of this Health Supplier segment are available at hpr.fm and also at healthprofessionalradio.com.au, and you can subscribe to our podcast on iTunes.